Have you ever had someone say one ultrasound scan report said everything was normal, but another one later found a problem? Or one diagnostic center said, I have a fibroid mass. The other one said, there is no fibroid mass. It happens very often. Not all ultrasound examinations are the same. The quality of your results depends not only on the machine, but also on the people performing the scan and the standards maintained by the diagnostic center. So how do you know if you are choosing a good diagnostic center? Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound and women's health education. And if you've ever received two different ultrasound reports and you are wondering which one is actually correct, come to the front seats. Here are 7 things you should look out for when choosing or visiting a diagnostic center. Number one is qualified and experienced personnel. The most important part of an ultrasound examination is not the machine, it is the person operating it. An ultrasound machine does not automatically detect disease. The sonographer has to know what to look for, how to examine each organ properly, and how to recognize normal and abnormal findings. Experience is very important because different examinations require different skills, and only a thorough scan can detect subtle abnormalities that may have been overlooked elsewhere. Many people believe that buying the newest machine guarantees the best diagnosis. That is not true. A highly skilled sonographer can often produce better results on a well-maintained machine than an inexperienced sonographer using the most expensive ultrasound machine. Number two is modern and well-maintained equipment. The quality of the machine is also very important. Modern and properly serviced ultrasound machine provides clearer images and better resolution, making it easier to detect abnormalities, especially small or very early ones. The third thing you should look out for is the examination should never feel rushed. A good ultrasound examination takes time. The exact length of the scan depends on the type of scan you are having, but every examination should be thorough enough to answer the clinical question. If someone finishes your scan within just a couple of minutes without carefully examining the area of concern, there is a greater chance that important findings could have been missed. A quality examination is careful, it is systematic, and it is focused. It is not rushed. The fourth thing you should look out for is the sonographer asks questions before scanning. Have you noticed that a good diagnostic center usually asks you questions before they begin the scan? They may ask questions like, why were you referred for the scan? What symptoms are you experiencing? How long have you had these symptoms? Have you had any previous surgeries? If you are pregnant, they might ask you questions about your pregnancy history or your LMP. These questions are not just routine conversations. They help guide the examination and ensure that the sonographer pays close attention to the areas that may need more assessments or the areas that needs more detailed assessments. Good information leads to better examination. This is also the reason why most doctors ask for clinical information before they begin to examine you or before they begin to dish out treatment, because information and patient history is very important. The fifth thing you should look out for is a comprehensive ultrasound report. Your ultrasound report should do more than simply saying normal or abnormal. A good report clearly describes what has been seen during the examination. It includes important measurements when necessary and provides a clear impression or conclusion that your doctor can understand and use to guide your treatment. A detailed, well-written ultrasound report is a sign of a quality diagnostic service. The sixth thing you should look out for is hygiene and professionalism. Always pay attention to how the diagnostic center treats both you and the equipment. The examination room should be clean. The ultrasound probes should be cleaned appropriately between patients. Your privacy should be respected throughout the examination. The staff should communicate professionally, explain the procedure, and treat you with respect. These things may seem like small details, but they reflect the overall quality and standards of the center. The last thing you should look out for: don't choose based on price alone. Everyone likes to save money, but choosing the cheapest ultrasound service is not always the best decision. A poor quality examination may lead to missed findings, incorrect diagnosis, unnecessary anxiety, or the need to repeat the scan elsewhere. Sometimes the cheapest scans becomes the most expensive because you end up paying twice because you have to repeat the scan somewhere else, or you start the wrong treatment not meant for you, thereby paying with your health or your life. So instead of asking how much does it cost, also ask, can I trust the quality of the examination? Here are some of the warning signs or red flags you should watch out for. The first one: no one asks you why you are having the scan. The examination is rushed without proper assessment. Communication is poor throughout the procedure. The report is vague. incomplete or lacks complete details. Another thing, if you frequently need to repeat the same scan elsewhere, you should be watchful of going back to that center. Please note, it is important to remember that not every difference between two ultrasound reports means that one center is wrong. Sometimes some conditions may change over time, some findings may become more visible as the disease progresses, and experienced professionals can occasionally have different interpretations. However, consistent high-quality ultrasound practice reduces the chances of significant error. So remember, an ultrasound report is only as good as the sonographer behind it. So choosing a reputable diagnostic center can make the difference between an accurate diagnosis and unnecessary confusion or delayed treatment or having to repeat the scan. So the next time you are booking for an ultrasound, don't just ask about the price, ask about the quality, because when it comes to your health, accuracy should be at the forefront. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. And if you found this video helpful, don't forget to like, share, and subscribe. And then I would love to hear from you. Have you ever received two different ultrasound reports from two different diagnostic centers? Share your experience in the comment section, and I'll see you in my next video.